Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been really struggling since the last injection. It actually made my pain worse. I've had injections before that helped a bit, but this one was different. I don't think it was administered properly. I don't want to go back to that provider again. I think the previous one was way better.
I'm sorry to hear that the injection didn't provide relief and even worsened your symptoms. It's important that you feel comfortable with your provider. We can arrange for you to see the previous provider who you felt was more effective. Can you describe more about your current pain and how it's affecting your daily activities?
Well, the pain is mostly around my lower back and hips now. It doesn't go down my legs like sciatica or anything, but it's really intense, like sharp burning that just doesn't let up. It's worst when I'm trying to bend over or when I'm standing for a long time. Sitting for a while helps a little, but then getting up is a struggle. It's been affecting my sleep too. I just can't find a comfortable position.
That sounds very challenging. We'll need to explore some other pain management options. You mentioned earlier that you were taking Vicodin and morphine. How are those working for you currently?
The Vicodin is okay. It takes the edge off better than the morphine. Morphine makes me feel sick, gives me terrible joint pain, and just doesn't sit well with me. I'd rather stick with Vicodin for now. And about amitriptyline, I'm a bit hesitant to start new medications because of my past experiences with side effects.
Understandable. We need to make sure whatever treatment we use is tolerable and effective for you. We'll keep Vicodin as the mainstay for now, and we can revisit the idea of amitriptyline or another medication for neuropathic pain later if you're open to it. It's also important to manage your pain without exacerbating other symptoms.
I appreciate that. Also, I was supposed to get a psychiatric referral, but I don't really think that's necessary. I know my body and I know this pain is not in my head. I'm stressed, yes, but who wouldn't be with this kind of pain all the time?
Pain is indeed a physical experience, but it can be influenced by and also influence our emotional state. A psychiatrist could help manage not just potential mood symptoms, which could be contributing to an amplification of the pain, but also teach coping mechanisms for dealing with chronic pain. However, the decision is yours, and we'll respect your choice on this matter.
I'll think about it, but for now, I'd rather we just focus on the physical aspects. Can we also check on my other medications and maybe adjust them if necessary?
Of course, let's make sure all your medications are up to date and that you're not running into any shortages. You mentioned needing a refill for your stomach medication, but declining additional blood pressure medication as you have enough. We'll make sure all your prescriptions are filled properly.
Yeah, that would be helpful. Living on my own, managing all these things gets a bit much sometimes. I try to keep up with everything, but it's hard when you're in pain.
Absolutely. Managing chronic conditions and medications can be overwhelming, especially when dealing with persistent pain. Based on our discussion and your current symptoms, we will continue with the Vicodin as needed. We'll hold off on starting amitriptyline until you feel more comfortable with the idea of trying a new medication. I will refer you back to your previous pain management provider for a repeat of the pain management interventions that were previously effective. We'll schedule a follow-up in 4 weeks to evaluate the effectiveness of the pain management strategies and check on your overall well-being. At that time, we can discuss any adjustments to the plan based on your response and consider further imaging or physical therapy if necessary. Your blood pressure is stable at 130/85 mmHg, heart rate is normal at 78 BPM, and other vital signs are within normal limits. Your liver function tests show slight elevations likely related to medication use, which we'll continue to monitor. CBC and renal functions are normal. However, your CRP is elevated, which correlates with your reports of increased pain and inflammation. We should monitor this along with your ESR, which is also slightly elevated.
Thank you, doctor. It feels good to have a clear plan and to know that you're taking all my concerns seriously. It gives me some hope that we can get this pain under better control.
That's our goal. We'll work together to adjust the plan as needed to ensure you get the best possible care. I'll see you in 4 weeks unless something urgent comes up before then. Take care.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been dealing with diabetes for over 30 years now, and I must say, it hasn't been easy, especially with the dizziness and balance problems I've been having. I think it's getting worse, probably because of the neuropathy in my feet. My blood pressure hasn't been great either, which is why we adjusted those medications recently.
I understand your concerns. How have you been feeling since the adjustment in your blood pressure medications?
It's a bit better. The readings are improving, which is good, but I still feel this constant ringing in my ears. It started around the same time we changed the meds. Could there be a connection?
Ringing in the ears can be quite bothersome. We'll check into that, but it's often not directly related to blood pressure medications. You mentioned issues with your feet due to neuropathy. Can you describe what you're experiencing?
Yes, my feet are often numb, and sometimes I get this tingling sensation like they're burning. It's worst at night. Walking has become difficult, and I'm worried about falling because I can't feel the ground properly.
That sounds challenging, especially with your history of diabetes. We need to keep monitoring that closely. You also mentioned a growth in your mouth. What can you tell me about that?
Well, it's been there for about 2 years now. I noticed it hasn't gone away, and it seems to be getting bigger. I smoked for a few years when I was younger, which I know wasn't good. I'm worried it could be something serious.
It's good that you've brought this up. We've already referred you to oral surgery to get a closer look and possibly a biopsy. Switching back to your overall health, how have you been managing your diabetes, especially with your diet?
To be honest, it's been a struggle. especially around the holidays. There's always so much temptation, and sometimes I give in. I know it's not good for my blood sugar, and my last HbA1c was higher than I'd hoped.
Diet is crucial for managing diabetes, especially given your long history. We'll keep working on that. You're taking vitamin D weekly, right? How many doses do you have left?
Yes, I'm on vitamin D. I think I have a couple of weeks' supply left. Should I continue with it?
We'll review that in a moment. Let's also talk about your ear issues. Have the eardrops help with the wax blockage?
I've started using them, but there's still some ringing. No relief yet on that front.
We'll give it some more time. Earwax can take a while to clear up, and the drops should help. Now, let's go over some of your recent clinical values and our plan moving forward. Your weight is stable, which is good, but we need to keep an eye on your blood pressure, which was 127/80 millimeter Hg during today's visit. Your fasting blood glucose is still a bit high at 180 milligrams per deciliters, and your HbA1c is 7.8%, indicating that your blood sugar has been above target. We need to address this to prevent further complications from your diabetes.
I understand. It's been tough, but I'm willing to make changes. What should we focus on?
First, continue using the blood pressure medications as we've adjusted them, and monitor your blood pressure regularly. For your diabetes, adherence to your dietary plan is essential. We'll also continue with your current insulin regimen. Regarding the growth in your mouth, follow up with the oral surgeon as scheduled.
Sounds like a plan. I'll do my best with the diet and follow up on everything else.
Great. It's important to tackle these issues step by step. We'll review everything again during your next visit, and we can adjust the plan as needed based on how things are going. Keep a close watch on your symptoms and let us know if anything changes, especially with your feet or the growth in your mouth.
Will do, doctor. Thanks for helping me keep track of all these things.
You're welcome. It's important to stay proactive about your health. See you next time, and take care until then.